My name is Emmanuel Manenga. I'm the Public Relations Officer, bonded Uganda Health Information Officers and Medical Records Association. Today, the medical records professionals take on the industrial action because their critical issue of salary harmonization and payment of arrears has not been catered for in the meeting which we had with the Director General. So we are requesting the government. We know this industrial action is going to affect the population and the country. Please give us attention. You handle this so that we have a lasting solution to this once and for all.
My cry is to this country. Yes, as we met our Director General yesterday, who did not address clearly our welfare. Our most important message to the Republic of Uganda, most especially our head of state, is not only the nurse, a doctor, a lab person, a radiographer who is important. We are also very important in these health facilities. We are saying them in 2018 their salary was raised. Our salary was not raised. We sit in the same room with these people, my dear people. Where doctor sits, a nurse is where I sit. We sit in the same room. What am I saying? We are saying harmonize this salary which was raised in 2018, so that also it cuts our fraud. Recently, when they raised the lunch allowance, we all got. That means we all qualified. That means I'm a health worker. How comes when it came to salary, we were missed out? And we are in the budgetary week, so let them put us in this budgetary week so that our salary can get enhanced in the budget of next financial year.
We want the government to pay our salary arrears, which were chopped from the financial year 2027 to 2028 to date. Secondly, we also want the government to harmonize our salary from U7 traditional civil servant system to U7 medical. Failure to do that, our industrial action continues.
For them, they know in the health sector we have on the doctors, we have on the clinicians, we have on the nurses, we have on the laboratory people. But let me tell you, we are all important in the health sector. Like I'm continuing to tell you, we have even cleaners who are not even seen in the picture. Now, if a cleaner does not clean for me where I'm going to sit to compile the data, where will I sit? We are saying if they are increasing salary, we are all in the PHC payroll, which means we are supposed to get all the benefits. Why would they deny us the benefits of which others are getting? And it is the same money. We are drawing money from the same source. You cannot tell me I'm working in health, then you're paying me from the other scale of traditional payroll. It does not work like that. We want all these things to be put at par so that everyone is happy. If we are saying from U8 up to U1, we are all in medical, let it be medical. Let it not be this card, I think, they don't see patients, they don't do what we see patients indirectly. By compiling all these things, we are seeing them. Okay? That is my appeal. I want whoever is concerned about this, please come out, because we are not happy with what is going on.
To tell them people who have died, those ones, the information they get, those people we are seeing that COVID is rising, people have died, people have been cured, whatever they've been reporting to the government, the president has been informing to the government, it is through us. It's us who gives him the information. But I think he doesn't know where that information comes from. So we are calling upon our president to come. Maybe he can understand. He's getting the information. These big people are giving him the information. He doesn't know where that information comes from. They are supplying drugs. When they supply drugs, it is because of our efforts. If we don't put efforts in the reporting system, there will be no drugs. You see the HIV. The HIV, they are giving drugs to those HIV patients. It's because of our efforts. If we don't report that we have new cases of HIV, people have died of HIV, TB, wherever there is an outbreak in the country, without us, they will not get any information.
Price in all health facilities for proper supply chain management by NMS and GMS and IPs for healthcare logistics. That means if there is no data, drugs will not go to health facilities because there is no how they are going to measure how much is needed here and there. We are taking custody of all the health records for all patients that get treatment in these health facilities through retrieval, filing, disease classification, and coding,
using the international standard is ICD. We undertake vital registration services such as birth and death that is used by this country to monitor the population and plan accordingly. So we also do birth and death registration to monitor that under UBOS. We also are responsible for integrated human resource information management system for monitoring health workers, attendance and performance. That's what we always do during that time. You see, we have cadres under U3, you see, and the other health workers. Our cadre in U3 is getting over 900,000. The other one is in 3 million, or 3.1. Our cadre at U4 is getting 700, but the other is getting 2.2 million. You see, when we have the same qualification and we are doing the same work actually, our cadre at U5 is getting 400, the other one is getting 1.2 million. Our cadre at U7, the one we are fighting for most, who are most affected, is at 300, and the other is getting 600 plus. So this is total mess. We're saying the government has to come and review this, and we are here organized, and this is too much for us. Medical workers, because we have been considered as non-medical workers, and yet all the training we go through, everything we go through is related to what other people whom we are working with, they are doing. So we have to presume we are at the same level with them, but that one, our stakeholders have to organize that. And that's why we are suffering like this in terms of payment.